Welcome back to Winning Isn't Easy. Let's talk about understanding Charcot-Marie Tooth Disease. So let's start out with the basics. What exactly is this disease and why is it relevant if you have an ERISA disability policy or plan? Now, CMT is a hereditary disorder that affects the peripheral nervous system. The peripheral nervous system is the network of nerves outside the brain and spinal cord that control movement and sensation in your limbs. So, in practical terms, CMT slowly wears away your ability to move normally and feel sensations in your arms, your legs, your hands, and your feet. It's categorized as a hereditary motor and sensory neuropathy. So that means it impacts two functions that we rely on most to move and function throughout the day: the motor nerves, which control muscle movement, and sensory nerves, which allow you to feel temperature, pressure, and pain. And what does the damage look like in real life? That's important because this is a progressive disease. So, one of the earliest signs is muscle atrophy in the feet or lower legs. Think of that as muscle loss. And it often leads to a high step gait or a foot drop. People with CMT often struggle to lift their toes while walking. And as a result, they're prone to trips, falls, especially on uneven surfaces. Now, over time, the weakness is going to spread to the calves, making it difficult to stand, walk, or balance without support. Many individuals end up needing assistive devices like braces, canes, or even scooters. But the upper body isn't spared. CMT can also cause muscle weakness in the hands, leading to reduced grip strength and trouble with fine motor skills like buttoning a button, typing, tying a scarf. Then there is also the sensory loss. As the disease progresses, people will have reduced sensitivity to touch, temperature, and pain, particularly in the lower extremities and feet. That means that they may not notice when they've cut or burned themselves, or they may suffer alternatively chronic aching and burning sensation, which is a horrific feeling. In fact, it's not uncommon for CMT patients to describe their feet as numb but painful, contradiction that highlights how complex and uncomfortable this disease can be. Now, another thing to consider, particularly if you're thinking about applying for long term disability benefits, is that CMT is progressive. It worsens over time, although the rate will vary from person to person. Some people maintain the ability to mobility well into their middle ages. Others will lose function earlier. Unfortunately, there's no cure, and only there's symptom management, if you will, physical therapy, and adaptive strategies. So, why does this matter in the context of long term disability? Well, what starts as a mild discomfort can evolve into a complete inability to perform your occupational functions. And when that happens, you need to understand how to prove that your condition meets the criteria for your specific long term disability policy or plan. So, we're going to next talk about long term disability policies or plans and some of the common obstacles that people face when making a claim for short and long term disability benefits. Got it? Let's take a break.